I would like to speak to you, with you of what the research or the job that we've done in two countries of Central Asia, in Uzbekistan and in Tajikistan, in the Fergana Valley, which is a valley which is shared between three countries, Kyrgyzstan, Uzbekistan, and Tajikistan. And we are working in the Uzbek and Tajik part of the valley, which represents around not something like 13 million inhabitants. We've been working there as the International Secretariat for Water for the past 20 years. And we've implemented projects to improve the rural population's health through sustainable rural water supply and sanitation, as well as improved household hygiene and hygienic behavior, with the idea to build up a fully autonomous rural water supply and sanitation sector, which is managed in a decentralized way. All in all, what we've done so far is that we've helped 250,000 people to have access to water, much less to have access to sanitation, which came as a second objective, the first and primary objective being to work on the access to water. But then step by step, because water without sanitation is absolutely not affordable, we came to sanitation, and we've undertook some research on this topic. What we have found out in any case is that the participation of women in the management and in the decision-making bodies of the water systems, which are managed individually by each village, is absolutely essential. As the previous speaker was saying, very often it is ignored or neglected, but in fact it is absolutely essential. And what we found out is that the water systems that are managed by women are usually managed in a more effective and better way. The idea as well was through the access to drinking water and improved hygienic behavior to reduce the number of waterborne diseases that we've reduced as an average by 50%, but in some places it was reduced much more than that, 80 or 90%. When I'm speaking of waterborne diseases, we are speaking of diarrhea for children, but also hepatitis, typhoid, and these kind of things. There were places where the number of cases of typhoid was extremely high and it has almost completely disappeared. The other element is that the water systems that we are building up with the villages are financially viable, with a tariff that covers all the costs, and including the investment cost, and which is affordable for all, including the poor people. So it's an inclusive approach that we have, and with a lot of training to make sure that the local actors are able to replicate the approach that we have proposed. So to summarize, what we have built up is drinking water supply systems in rural areas that are managed in a decentralized way through the establishment of drinking water organizations that are managed by the people. And as the previous speaker was saying, there's also something extremely important if we want to be successful in this approach, apart from the fact of having access to a water source, is the social cohesion, social level of probably inclusion of people, etc., and which is also a key element. Financial transparency is, of course, essential when people are managing by themselves their system. Sustainability And finally, we've included an extremely important program of hygiene, which is training on a number of practices. I'll come back to that. And we've built up a certain number of improved sanitation facilities that I will show you a little bit later. We've conducted, in order to have a better idea of what is the situation of people, and what I'm speaking of doesn't mean that the survey that we've built up is representative of the whole Fergana Valley, but the main features are probably all there. And so this survey was conducted in one village of the Fergana Valley on hygiene practices and sanitation, access to water, etc. But I will focus on hygiene practices and sanitation. It was 500 interviews that were conducted with quantitative and qualitative questions, and the sampling was a random sampling, since it was not possible to build up a sampling through quotas. The survey was conducted in 2017, and the results are still exploited and used. Coming to toilets and types of toilets and types of pits, basically in this village, but it's the case in most of the places in rural areas in Central Asia, and especially in the Fergana Valley. 62% of the households use pit latrines without slab. 34 use pit with concrete blocks as walls, and 2% use ventilated improved latrines. So we are in extremely basic, unimproved type of latrines. Now, and this is there that the gender issue is something extremely important. Who cleans and who repairs? Almost, more than 92% of the cleaning is made by females. And if almost 70% of the repairing is made by males, still 31% is made by females. So women are playing here a key role. Of course, this presentation is not questioning the roles between men and women. It is just a picture at a given moment. And it also says that if we want to have a key impact on hygiene and sanitation, the vector of this impact is definitely through women. And now, what is the degree of satisfaction of the toilets? As you can see, even with an extremely high level of unimproved pit latrines, the degree of satisfaction with the toilets is still quite high, with 70% of people saying that they are satisfied of the toilets, and only 3% not satisfied, absolutely not satisfied, with 24% not satisfied. So it's a small proportion of people who are not satisfied with toilets that we know are dangerous or can cause major problems. So the work to do there is extremely important. If we have a look at why the people are satisfied of their toilets, they find it safe, hygienical, and convenient. Needless to say that all those toilets are located far from their house. All the people in rural areas have a yard, and the toilets are not attached to the house. They are far from the house, which of course increases the lack of safety or the lack of comfort, of convenience. But anyhow, a vast majority of people find them convenient, hygienical, and safe. So there's a lot of work to do if we want to improve the situation. And the reasons when they are not satisfied, the reason of the dissatisfaction. So I reminding the level of dissatisfaction is 27%. 24 are not satisfied, and 3% are absolutely not satisfied. So the reasons of the dissatisfaction is the difficulty to clean, the fact that it is uncomfortable, the smell, far from the house, and not hygienic. Now, our objective is to protect and promote the public health, protect the environment, and we've tried to improve the situation of toilets by targeting toilets into public places. In houses, the toilets are not necessarily very dirty or they are still not safe. There's a lot of work to do, but the toilets in public places are extremely bad in general. I'll show you a couple of pictures just after this slide. And we've tried to bring an answer to the toilets in schools so that children can be used as well as a vector to improve the toilets in their own household by explaining that at school they have something which is of a better quality, which is technologically appropriate. They will not formulate it like that, of course, but it's what we're trying to promote, which are economically affordable. So we've tried to build up toilets that are clean, safe, comfortable, and not expensive, and that are culturally acceptable. I'll come back to that a bit later on, but essentially that are inclusive of differences between men and women into the toilets, which are usually not taken into account. So here are a few pictures of a few toilets in kindergartens. As you can see, it is not a very good quality. It is far from the school. It is in winter difficult to use. You have the second picture on the right-hand side is in fact complete open defecation. There are no toilets. There is a land where, I don't know, yes, here, there is a land where basically children are defecating. And as you, first of all, it's not safe. Second, as you can imagine, in winter, it's a complete nightmare. Here are public toilets in villages with, you have a number of schools with where toilets have no separation walls, where the cleanliness is far from being satisfactory, etc., etc. I guess a number of people who are working in those countries know such situation. This is what we have tried to build up: either toilets with flushes and septic tanks, or or Ecosan toilets, where the liquids are separated from the solids at the time of emission and then are used as fertilizers. As you see, this is the toilet of that we've built up in a school. There is a land around the school, and the urine and the feces can be used as fertilizers for the garden in the school. When I was speaking of toilets that are culturally acceptable, one of the key criticism which is made against Ecosan toilets is that where the liquid and the solids are reused, is that it's culturally not acceptable. In fact, in most of the cases, what we have found out is that it is culturally non-acceptable for the implementers, but it is very much acceptable for the users. So in other words, this questions more the work made by NGOs like our NGO than the use of people in rural areas who are used to use this kind of byproduct as fertilizer, especially in countries where one of the main cultures, is cotton and has no food consequences or food producing. But even for food producing, it is still acceptable. I will not enter into too many technical details on the wastewater management of toilets, etc., but one of the key elements as well that I like to underline is that the existence of a septic tank in the former Soviet Union is not, or the concept, of a septic tank is not understood in the same way as the concept of a septic tank in Europe. For instance, septic tank in the former Soviet Union is, in most of the cases, a pit where no process is taking place, whilst in Europe it's a pit with a process that is taking place and where the byproducts can be reused as well. So one of the key elements is that the toilets in public places are an extremely neglected issue. One of the things I like to mention, for instance, is that we had a meeting not long ago in one of the two countries that by charity I will not mention. And the deputy minister who was chairing the meeting at some stage was interrupting a presentation on toilets and saying that he was forbidding us to use the word toilets because it's not a nice word to be used in public meetings, and that there are more poetic ways of speaking of that are more distant from the reality. So there's clearly a lot of work still to do, both at public and private places, but the public places are more in danger than the private places, first. And second, the public toilets can also be a tool to convey the message of improving sanitation. One of the key things as well is that the needs of women are usually not taken into consideration. For instance, there is no places for teenage girls who are already in time of menstruation, and they don't know where to go when they have to change their protection, or and very often, this is very well known, it's one of the causes of absenteeism of young girls, young ladies at school. Also, one of the things is that there's a lack of budget for hygiene and sanitation maintenance, which is extremely small, but requires, in fact, that attention is paid to this very topic. Otherwise, it causes problems, of course. What are the lessons that we've learned so far? That it is necessary to take into account the entire sanitation chain, from access to water to the use of byproducts, and if possible to propose solutions where it is possible to use the byproducts of toilets. Everything that was said before about the enabling environment, the institutional support, the skills and capacities support from the stakeholders, for instance, the Ministry of Education and the Ministry of Health are key people there. It took us a long time, for instance, before we could have access to school, because the Ministry of Education didn't want that we were changing anything to the existing situation of toilets in the schools, because it doesn't correspond to the standards and norms, etc., etc. And the Ministry of Health in this respect was extremely helpful, but it and it took anyhow a long time to be able to approach. I mean, to work with schools. The participatory approach must involve women extremely strongly, either through one of the things we found out as well is that it's necessary very often to organize separate meetings with women on the one hand and men on the other hand, and before being able to have both genders sitting together and being able to manage together the water systems and the sanitation systems. And we found out that the systems with women in a key position are better managed and more effective. What we've done as well is that we've built up, in parallel to pilot sanitation facilities, I mean toilets, we've built up a large training program which was targeting teachers in schools and doctors and nurses in medical points, so that as vectors here too of improved hygienic behavior, using the FAST PHAST methodology developed by the United Nations. And we have been able to develop this program at national level. We started at regional level in Uzbekistan, in the Uzbek part of the Fergana Valley, and have scaled up the training at national level. We've been able to reach 10,000 schools there, and in each of the schools of the country, there is a focal point for water and hygiene related to water, who is every year delivering elements of training on hygiene related to water, and also taking an active part on the World Water Day, the World Toilet Day, and sensitizing children to this kind of topic. We've done the same in Tajikistan, in the province where we are working, and this has contributed, without even sometimes having access yet to safe drinking water, this has contributed to a significant reduction in waterborne diseases in the two countries. Thank you very much. I hope I could be useful and brought some elements to you. Thank you for your attention.